But many, many more cannot afford it. Many, many more can simply not afford it, and what this bill will do is put us in place a sliding scale of affordability credits that allows people up to 400% of poverty to go out and buy insurance. So the goal is to get everybody insured so that everybody has access to the basic care that keeps people well. And as we are, as a nation, more well, the cost of care across the system will come down, and everybody's insurance premiums over time will come down, and assurance coverage will come down.
As you get older, they're going to dictate what kind of help you're going to be able to get, which concerns me. If you have an elderly parent or a grandparent, they may get sick, that they're going to dictate whether or not that they think that they're old, too old, you know, let's go to hospice and take care of it that way. I'm happy with my health plan. I mean, I don't see any problem. Rights, just like everybody else. Everybody comes here. This is land of the free. We have our right to talk, right to opinions, right to disagree. This is our right. If we don't like it, don't pass it. Let's vote on it.
I just addressed a couple of the issues that you talked about in there. One is the issue, there is a provision in there that does, I've had 3 significant people die in my life, and as we all have, our parents, whoever. And in the course of that, of their illness, especially 2 who are older, 1 who should have been older. At some point, there comes a moment where patients need to talk with someone about their choices, for their choices. What you're referring to is now in Massachusetts. In Massachusetts, there is a statute, so that if you go into a hospital, you have to sign certain forms that say who your designated decision maker is for certain legal affairs, medical choices, whatever. What this does, and yes, and that's the choice, people make very individual choices. What this bill does is encourage those discussions that make those individual choices with a physician if you wish. And if the physician takes the time at the patient's behest to do that, it provides reimbursement through Medicare. It's really a provision to assist helping the doctor. It doesn't mandate the discussion. It doesn't mandate an outcome. It simply says, as we all have to have those discussions, if we choose to have it with our doctor, that the doctor can bill for his time.
My question to you, Congressman Tsongas, is if this is such a great plan, why did you opt out of it when you took the vote?
You know, people often say, why don't the American people have what those of us in Congress have? Yeah! Let me explain what I have. What I have is a tremendous array. Last year when I went to a discussion, what I have is a tremendous array of choice. And I made a choice based on what I was willing to pay for and what made sense in terms of coverage for me and my family. That is essentially... essentially what we're creating for the American people. We are creating greater choice.
The question is, what is the alternative? So that's the question. You got that out front. The leader, the national leader of the so-called Tea Party that's disrupting this meeting right now was... You can talk all you want because I have the microphone. And the faster I put the microphone down, the better you'll be able to bullshit this audience. The leader of this organization that is causing a nationwide uprising against healthcare reform was indicted for $1.7 billion of Medicare fraud.
I feel that as an American, we should have the choice in this. I know that Congress speaks for the people, but this is not speaking for the people, because I know many... not going to have a choice anymore from my parents and from my grandparents. Why is Congress not going to take the same insurance that y'all are going to impose on us?
But you do have choice. Yes, you do. What kind of insurance do your parents currently receive? What kind?
Blue Cross Blue Shield.
And do they get it through their employer?
Yes.
Yes. Well, this is going to strengthen the employer system. It does nothing to undermine.
And there are a couple of other things that I have concerns about.
Well, what would it take to feel better about? What would you need to hear?
To know that if I want the choice to leave, if I want the choice to leave Blue Cross Blue Shield to go to Mass Health, or to go to Aetna, or to go to United Healthcare, that I have that option, because it's important to me for my health, for my children, for my family, my parents, and for my grandmother, that we have that option.
Well, can I unravel this a little bit? There are a lot of issues embedded in that question, many. So for example, now what happens if you have employment-based insurance? Your employer negotiates with the insurance companies, the insurance companies and the employer go back and forth about the benefit packages, and they create a benefit package and a payment schedule. So some employers will offer a couple of choices, some will offer only one. But if you have a choice, you go into it, you say what, and you have a copay, and your employer picks up a piece of it. So you go in, you look at the choices that the employer has crafted for you. They've crafted those for you, and you look at that line, and you say, which one do I want to pay for? Which one's going to give me freedom? Which one's going to, it'll cost a little less, but constrain my choices? But you make that choice. But your employer has decided which insurance companies you're going to have to choose from. And that's the employment-based insurance model we have today. And to some degree, it works, but often, first of all, it's very hard to understand what these different insurance packages include. There's not a comparable benefit package.
But in all due respect, if you don't mind, Congress has allowed the insurance companies to conduct this way, to create this kind of a system. So why is it then the people have to pay for it and then suffer under one single system and not have the choice?
Well, that is where, first of all, there is a recognition. There is a recognition that the insurance companies need to be reformed. So that's where you get into all these...
I understand the insurance, but not the people of the United States of America.
Well, then that's why we've gone and created an exchange. And in the exchange, there is a provision. If in your employer-based insurance that you end up paying, I think it's about 11% of your income to meet your piece of the premium requirement, you can opt out of whatever your employer offers and go into the exchange and take any private insurance company that is there, and if we're successful with the and you will make that choice with all those, let me just finish, with all those reforms dependent upon the same things you make it with your employer. Is the network cover the physicians you want? There will be basic benefit packages that every insurance company will have to include, but over and above it, there can be variations. You will have, now it's going to require us as consumers to do our homework, pay attention, but it will make it far more transparent and give you a choice.
Will that, after what I read in the bill, after 5 years phase out? After 5 years, isn't it going to phase out into just, that's what I read in the bill.
There is an element that allows people who currently are on the individual market, buy their insurance individually, to be grandfathered in. You can stick with the plan, your plan, as long as you want. But there is a provision that employers over time are going to have, whatever insurance plans they offer, are going to have to meet the basic benefit packages. Again, so you have transparency. You're comparing apples to apples among the choices that they offer you.
I'd like to reiterate what the last person said, which is, yes, this is the United States of America, and our biggest shame is that people are dying because they can't see a doctor. I think everyone in this room could actually agree that we don't want our people to die. We're all in agreement on that, right? We do not want to see people die, okay? My grandmother died under her private insurance plan of breast cancer because of a pre-existing condition. The system is not working. People are dying, and that is not okay. Congressman Tsongas, I'd like to thank you for your work, and my ask of you is that you continue to push to change what we have now so that we can prevent unnecessary deaths. Thank you.